You are watching the DocTalk show.
People have talked about IVF, that seems to be the common word on people's mouth.
Yeah, so in IVF, that is called in vitro fertilization. The first baby in the world was born in 1978. And currently she's even had children. If you are interested in this field, you can read about that lady. In IVF, basically what it means is that we prepare the lady to be able to grow some eggs, as well as be able to carry the baby. Then the husband gives us sperm. We mix them together in the lab, and we try to recreate that environment that would have been inside the woman, but we recreate it outside because there is a reason why they cannot be able to have a baby. Fertilization takes place outside the body, and within 3, some people 5 days, you can be able to do a transfer of these eggs, which are now embryos, into the lady.
Of course, you know that there are so many stories around that. They are going to grow my baby in the test tube. I mean, people have myths.
Yeah, will it be a normal baby?
Families, how can I have test tube babies? You know, things like that are a very big challenge. And does everyone qualify to have IVF?
Well, most of the people actually do qualify for who have tried to have a baby. Do qualify to have IVF. But of course, there are sometimes when IVF itself might fail, and so we might move on to another thing, especially if we have problems with a male gamete, the sperm. That is when we need to move a little bit further than that. But of course, there are those other women whereby we have the eggs have reduced markedly. Okay, we call it diminished ovarian reserve, whereby even when you do IVF, you don't have any eggs growing. It's not only
age which affects that?
Age is a very, very important factor.
Yes.
Age is a very important factor.
There have been success rates in people who are really advanced in age, a few of them 60 plus. And there are those that, you know, IVF also, there are those cases where people have had chronic bad infections, especially with their tubes. And I've handled a few cases where IVFs have failed because of chronic infections. So is this also something that given the fact that most of the problems with fertility or conception is related to people's tubes, to women's tubes, is this something that you commonly see?
It's very true. You have to have a very good evaluation of the couple when they come and try to treat all those factors that might bring problems with conception. Infection per se, especially if infection is still there in the tube, you need to treat it first, okay? And then be able to do IVF. Otherwise, definitely you're bound to fail.
So IVF is one of the simple methods, or is there?
So the way you have said it, it's like the success rates would depend on not only the center where you go, but also individual by individual. Yes. Because there might be similar people, almost similar, the tubal problem, but there could be a tube with maybe an infection, and so meaning each patient should be handled like different. It's not because people always say no, the success rates in this center are good. I've had my friend got pregnant from this side.
You'll have your tube with an infection, another one will have a tube with lots of scars, another one will actually have their tubes tied earlier on, and now they've changed their mind.
There's even a male problem.
Yes, exactly. And of course, we've been talking about, especially for the tubes, if you have something called a hydrosalpinx, water in the tube, that is a big problem. You have to treat it before you do IVF. But of course, we don't need to forget, currently the world has gone into what they call individualized patient treatment, where we look at the individual and assess them as an individual, not as a group. But of course, all the time when I talk to my patients, I tell them your success is either 0 or 100%. True. Don't talk about 70% or whatever. You'll either get pregnant or not.
The advanced techniques, is it because of the problems that they get advanced, or because you have failed on these the first ones that you have to go advanced? And does it anyway mean that when I go advanced, does it always come with a better outcome?
Well, the cost might be higher because we have to use more advanced machines to help with this problem. If the sperm, you put them together and they fail, the sperm fails to enter the egg because you know those processes which go on when the sperm is entering the egg. Sometimes it fails. So what you have to do is to get the sperm and put it directly into the egg.
So you bypass the barrier.
You bypass the barrier, which is
some sperms are very bad that they have to be shown where to go.
exactly. So
Or the eggs are very stubborn that they will not let a sperm
the
enter.
eggs have a wall around themselves. So
The hard ones.
Because usually you have an egg or the female gamete, then you have a sperm that should be able to penetrate through that wall. Yes. So sometimes actually what he's talking about is that the sperm fails to penetrate. It could be a problem with the sperm, it could be a problem with the egg itself. So this, you actually introduce the sperm inside the egg.
that is called ICSI, okay, in our language. And of course, sometimes that also fails because we try to pick the best looking sperm, okay, that has the qualities, not the handsome, but the one that has the best qualities. So we look at the best qualities of the sperm and then we use that. But sometimes even the one which looks the best might not be very normal, okay? So now we have to select the sperms according to the characteristics that they are exhibiting. And then we still use that one to put it directly into the egg. Something we call IMCI, IMSI. IMSI.
So really, your laboratories here are doing a very...
Yes, most of the laboratories.
Okay. So you're preparing these mothers, all that time, you need quite a lot of time to prepare.
Yes, we have different treatment options that we have, but it usually takes an average of about maybe a month, sometimes 40 days to have this, because we have to follow the woman's cycle to be able to do this.
Dr. Mark, we have a very huge range of people who have problems having children. We've seen the very poor struggling to have children. We've seen the very rich struggling and ultimately failing to have children. So who really qualifies to come to your clinic for this method?
Okay, thank you, Jaffa. The most important thing is that the patient has to be seen by a qualified doctor to be able to do that assessment, the initial assessment that this person is falling into the category of infertility.
Yeah, because what I know, it's rare for people to just walk into your specialized clinics of infertility.
There are many referrals.
Yes, there are normally referrals from other medical practitioners, other gynecologists and stuff like that.
So when they come and that diagnosis has already been made, then you look at the different treatment modalities. But we have those particular ones where they've failed in the conventional methods. Because
even in our populations, Dr. Bile, populations come, someone will come to you and they'll tell you, I've been on Clomid, which is very commonly used
now.
Like
paracetamol.
It's over the counter.
Like
I've used the Clomid, doctor, I'm not conceiving. People know Clomid, yes.
They even see when you're writing, I said, doctor, that one I've used.
This one I've used.
Yeah, very true.
Yes, they've tried to look at their cycle, look out for the unsafe days. They've used fertility enhancers, they've used the herbs, and they have failed. So these are the conventional methods we are talking about, right?
Yes, exactly. And of course, but majorly the ones that we see are either advanced maternal age, and of course tubal problems when the tubes are completely destroyed and they're blocked, and of course the male factor. We don't have to forget the male factor. There are so many people who come in when their sperm counts are very, very low.
You are watching the DocTalk Show.